If you have unresponding neck or low back pain, this is a must-watch video for you. Today, I'm going to talk about spinal decompression therapy. Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. This is one of my favorite therapies to use when people have not been responding to traditional methods, and we're going to talk about it next. In the world of neck and back pain relief, there are a ton of things that work. Everything from stretching to exercise, to shots of different medications, to topicals and creams and nutrients. All of these things can work. And in fact, they do work. But there are times when some of that stuff hasn't helped. You've gone to the chiropractor, to the massage therapist, to the acupuncturist, and things just haven't seemed to be moving, but it is still a musculoskeletal issue. It's not something that requires surgery. What I've found by working in this industry for 30 years and now seeing patients from Ramos Law going into providers of all kinds, there's so many ways to take care of low back pain. But one thing that's really cool, it's one of my favorites, is called spinal decompression therapy. So I wanted to just take a moment on a video to tell people what spinal decompression is. And in fact, I've had a lot of questions about it, so I thought I would answer that for you. So what is spinal decompression therapy? Basically, it's taking the spine and loading it onto a table and then locking it down to where one edge of the spine is hooked to a table with a motor that's tractioning the spine. The other end of the table is just harnessed on, so the patient is laying flat, and then over time, we're gonna get a separation. Now, this is different from traction in that in traction, basically the body's just kind of going back and forth, while in decompression, it's a logarithmic motion that's pulling this along a axis. It's called spinal axial traction, and then it's holding it and it's releasing it partway, not all the way. So if it gets the spine stretched to here, it releases to here, and then it pulls to here, and it releases to here, and so on for up to about 30 to 40 minutes, depending on the treatment, and as low as 15 minutes. And it will take that spine at different angles, and it causes something called inhibition, where we're gonna have fluids rushing into that spine, whether it's the low back or the neck, and healing some of the injured tissues that have gone awry there. Now, I've seen this work for everything from some disc bulges, as long as they're not too bad, some disc bulges, to even stenosis and arthritis. All of these things have done really good. Sciatica, I've seen great results by providers using decompression, especially in conjunction with then exercises at home and with proper lifting techniques. So spinal decompression has been something that, again, I've seen it create literally what some patients call miracles. So when it comes to conservative care, I love spinal decompression therapy. If your provider does it, you can ask your provider questions about it. It's something that you do need to go into an office for. It's not a home treatment, but super effective. Now, if you have questions about spinal decompression therapy, you can certainly reach me, jim@ramoslaw.com. You can call our office, 303-733-6353, and ask for me, or you can send a message any other way that you like. So, spinal decompression therapy, check it out. If this was helpful, send it to someone, share it. We'd love to get the message out about what's going on for people's health. And until next time, remember, take care of your back, because your health matters.